Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. I just came back from lecturing this morning at Howard University to the amazing orthodontic residents over there, so I'd like to give them a shout out. This clinical pearl comes from a question that I received on a previous video. And the question was, what do I do if a general dentist or even an oral surgeon rejects the treatment plan that I suggest? I recommend extractions and the general dentist does not want extractions. Maybe they are misinformed about the effect on airway, or they believe that they need to keep that canine at all costs. And I think the way I'd like to answer this is I think it is important for all parties involved, the orthodontist, the general dentist or oral surgeon, and the patient to all feel comfortable with the treatment plan. So I might feel that a canine is in such a bad position that it is not worth surgically exposing that tooth, and it is better for the child and the treatment to simply remove that tooth and substitute the first premolar in the canine position. If a dentist doesn't feel comfortable with that, I have no problem with them sharing their views, or if an oral surgeon does not feel comfortable extracting a canine, I have no problem them sharing their views. But before we get started, we need to all be on the same page, and sometimes that means either finding a new orthodontist that goes along with the treatment plan that the general dentist or oral surgeon feels comfortable with, or finding a new general dentist or oral surgeon that goes along with the plan the orthodontist feels with. So I think before anybody gets started, all parties, the doctors that are involved and the patient, all need to feel comfortable with the treatment plan. And I think it's wonderful if people have some different philosophies or different views, and I think that should be discussed. But the best way to approach it is before you get started, before any down payment is made, before treatment has started, that all the parties that are involved in treatment really need to get together and say, do we think this is a great plan? And I think it's important for the parent to understand that all the doctors are on the same page. So in my office, if I feel that I want a specific treatment plan that I really believe in my heart is best for that patient, and another doctor who is involved, possibly a general dentist or surgeon, does not agree with that plan, I don't disagree with that doctor, but I just simply tell the parent they need to really make the decision. Do they want to continue with our office and our treatment plan, or are they open to maybe finding a different practice who will go along with this treatment plan and be supportive of it? That is not an easy conversation, but I think it is an important one to have. But what we don't want to do is have a patient being ping-ponged back and forth between two doctors who disagree with the treatment plan in the middle of a treatment. This was a challenging pearl, but I hope you appreciate it, and I hope it was okay to introduce this difficult conversation. Thank you guys so much for subscribing to this channel. Thank you for supporting the JCO.